350 patients per day, 24 hours operation, 365 days per year, to partner with Pharma Access and M-TIBA. M-TIBA is going to help us in terms of information technology and collecting the revenue from the patient. Pharma Access is going to subsidize a bit the bill for the patient. They cannot afford the full journey with us. What is the difference is not only antenatal clinics per se, but is the journey that we are going to have. The full journey from the time of conception to 1,000 days. I'm welcoming all the mothers and the other partners with us and to start the journey.
My name is Nicole Speaker. I'm the CEO for Farm Access. We are an international organization that is helping people to get access to better healthcare through using digital technology. We're very excited to be here today at Neema Hospital, launching this amazing partnership on Tunza Mama. That is really one of our flagship innovations, empowering women to access predetermined costs and a predetermined quality of care, and empowering them to be able to access that here in Neema Hospital. The partnership is really with the hospital, who has been attaining international standards of quality of care. They are really committed to achieving this with the women. But the second partnership is with M-TIBA, who is empowering the women through the mobile technology so that they can access the services through their mobile phone. So really excited to be here today, and this is really a product for all Kenyans, so we welcome everyone to go to the hospital. The aim of the Tunza Mama is that in fact a lot of women are seeking healthcare and healthcare delivery, and hospitals just like Neema, faith-based hospitals all over the countries, private hospitals that are catering to women, many of them just living around the corner in Dandora, that are saving money to go to the facility, or that are asking their family members or their friends to help, because Kenyans are a very caring population. But when you go to the healthcare facility, you're not even almost always sure what the financial needs are that you have. So what Neema has done really here is that this is the price that we're getting. It's a package for the entire journey, including delivery, but also the first 1,000 days. So making sure that your baby is safe, and it's at predetermined cost. So women get a discount. We should definitely roll this out. This is all about empowerment. 50% of the Kenyans are seeking healthcare in private hospitals like the ones we are today. So helping them with care bundles, with these prepaid packages, allows them to access services while having a peace of mind that no unexpected care costs go along the way. Now, as Farm Access, this is one of the examples of the type of public-private partnerships that we are offering help to.
M-TIBA is a mobile-based healthcare infrastructure. We come as the digital platform to enable the mother journey being done here at Uhai Neema, followed by the partners in terms of access of care, from enrollment to access of care, and the whole journey from ANC to delivery, all recorded within the M-TIBA platform. The provider, we connect the payer, who in this case is the pregnant mother, and also acting as a patient at the same time. So the payer here is still the patient. This is the pregnant mother. And we connect them through this digital platform in terms of information collected for the treatment. We follow the ANC all the way to delivery, and this data output or data information or data exchange between the partners influences, of course, the quality of care in terms of monitoring the journey and ensuring that the delivery happens as expected. When these mothers are found early and the journeys is followed early in terms of quality, then we are almost guaranteeing a safe delivery and following the 1,000 days of the child having been delivered safely.
Tunza Mama is basically a product, a pregnancy product for mothers that helps in basically promoting adherence to ANC care for the mothers. As we all know, as mothers in Kenya, a lot of times mothers come to the hospital when you're pregnant, but later on in the pregnancy. Tunza Mama, therefore, comes in was innovated through Farm Access as a pregnancy solution that promotes ANC care, but through collaborations. Why is this different from the other products out there? The fact that the mothers are actually digitally connected to the healthcare provider. There is continuum of engagement between the provider and the mother throughout the journey. As a mother, I have a mobile phone, and through the mobile phone, I have visibility of the services that I'll be getting from the time I enroll for my ANC to up to 1,000 days of the child's life. With this, I know that, what to expect at every stage. The healthcare provider has visibility in terms of my condition, is able to get to me when there are any issues that crop up, as opposed to right now where mothers actually go to the hospital at a later stage and are not able to meet, and the hospitals are not able to mitigate risk. So this is a partnership basically between that was initiated through Farm Access as an innovator, and working with Uhai Neema, M-TIBA here, to try and do things differently with the aim of enabling better outcomes for the mothers and the children.
I am Dr. Kiere, obstetrician gynecologist, and this product, in terms of how it's going to impact care, one of the major challenges that we've been having is that a number of mothers are not able to attend clinics because of finances, or are not able to do the required investigations, again due to the limitations of finances. And yet that from our clinical side makes it difficult to provide the optimum care. So this package is going to allow both quality and quantity in terms of the number of visits that clients are able to come, and this is likely to translate into better outcomes, both for the mother and for the babies that they have been carrying. And this is then going to translate into less or fewer costs, because of when you have babies that are healthy, then even the costs associated with neonatal care also goes down. And that one, in a bigger picture, is also going to reduce complications that arise because the patients have come in late. And we hope and look forward to a partnership that will yield good outcomes for the mothers and for the babies. One of the challenges that mothers have, especially when you're serving the lower income segment, is that there's that inability, the financial inability to do investigations, for example, an obstetric ultrasound, and also other tests that are part of the antenatal profile journey. So with this partnership, there is subsidization, and that allows for this mother to do an obstetric ultrasound, and some mothers actually realize that they're carrying, for example, twins as opposed to a single gestation, and that has a ripple effect on how they will manage their pregnancy and how they will prepare for that journey. We also have situations where mothers have complications that come with that pregnancy, for example, elevated high blood pressures, which are a little bit more challenging to manage because they require a bit more financial outlay. So this partnership will allow for the subsidization of these costs and hence lead to better outcomes of these mothers.
Most of the mothers there or the women there would not have access to insurance or any other form of private cover. For some of us who are employed, we have the privilege of the insurance and are able to walk our mother's journey or our pregnancy journey using the insurance. But the informal sector, unfortunately, are left out in that aspect. And so it forces them to just seek services whenever very necessary. And most of it, you'll find it towards the end of the journey. And as Dr. was saying, that's where then complications are noted, and it could be quite late. So such kinds of products will help such mothers to start their journey early. And so these critical conditions or emergency that would can be foreseen or caught early, and then the journey's quality is almost guaranteed with such product.
If you asked every single mother, every single one of our mothers in this room, they'd have 20 different stories for their pregnancy journey, for their delivery journey, for their PNC visits, for their ANC visits. If you even ask one mother with more than one child, they will have 2-3 different stories for the same pregnancy journey. So what we, in partnership with every single organization in this room, we intend to make Tunza Mama, Uhai Neema, a song in our mothers' mouths. We intend to make this program reachable to everyone. We intend to make this program accessible to everyone. We intend to provide quality care to every single mother. We intend to make sure that from the moment you start, we will take care of you all through until your baby is 2 years of age. We will make sure that you get quality services. We will follow up with your appointments. We will make sure that you will have the best possible care to at least elevate some part of the stress that you're already feeling while carrying your baby.
Good morning, everybody. My name is Victor Abuor. I'm the hospital administrator, Ruaraka Uhai Neema Hospital. Basically, maternal health has been having quite a lot of challenges, especially where quality and financing is concerned altogether. Mothers will always want to get quality services where ANC and post-delivery care is concerned, while at the same time they are resource restricted. And so when we got into a partnership together with Farm Access, together with CarePay and M-TIBA, it was an opportunity for us to be able to bridge that gap, the gap of providing quality through affordable means to the mothers. And so for this particular venture that we are looking forward to, each mother that is able to get into this particular product we are able to journey with the mother from the ANC, from the point of conception, up to 1,000 days. Now, that will mean that we will be with this particular mother till we are able to celebrate the second birthday, if I'm not wrong, of this particular child. And that is a feat that we are so much glad and so much happy to be able to be a partaker of this particular journey. So we call upon each and every mother to be able to undertake this opportunity. We are going to work with you from the first day up to 1,000 day of life of this particular child. The mothers who are coming in for the first ANC visit, they were dropping out at a rate of around 60%, were dropping out simply because they were not able to afford the finances that were necessary for them to be able to continue their journey. At the same time, their main reason was coming out is that the quality, they are comfortable with the quality of the service that was being offered. However, in terms of meeting the financial obligation was a great challenge as far as they were concerned. So we looked at launching a product that was going to target the 60% who will naturally drop out because, one, they don't have specific insurance to be able to undertake their ANC journey and postnatal journey, and even later on as a CWC or the child welfare journey. And this is the target group that we are actually looking at. So this particular group of the 60, they are indeed willing to pay. However, the amount of money that are within their disposal to be able to make this payment was not sufficient enough for them to be able to cover for the service. So the partnership that we are having is to be able to bridge that gap. So yes, they are going to pay that little amount of money that they are supposed to pay, and then the partners are going to top up what they were unable to be able to top up. And we are looking forward that even this 60% will be able to have attained close to, we'll narrow this gap of the 60% more or less to a minimal percentage that could be left out.